The best data suggests that 1 in 10 paramedics will attempt to die by suicide at least once in their lifetime, says clinical psychologist Dr. Nick Carlton.
We owe them so much better than that.
Carlton is the lead behind a mental health monitoring system that's already being used by the RCMP. It asks members to document daily check-ins on their mental health with more in-depth monthly and yearly assessments.
So the system provides regularized feedback on an annual and a monthly basis that they can then export and take to a clinician of their own choosing or to another resource of their own choosing and say, look, here's where I'm starting to get into trouble.
He says research shows taking even a minute to reflect on your day is good for your mental health. And so far, that's proving true among RCMP members, he says. So now New Brunswick paramedics will be among the first provincial frontline workers in the country to try out the program too.
It's a tough job to think about. Obviously people always point to, horrific events that leave a mark on you.
Chris Hood says about 10% of paramedics are on medical stress leave at any given time. The hope is to intervene before it gets to that point. The medics' personal data will never reach their employer, manager, or insurer, but the program will wipe personal information and send employers an overall view of their team's health.
So that the frontline can essentially anonymously speak to all of the different leaders.
Hood says WorkSafe NB will fund medics' participation for the first 2 years. The association is committing to the third year, but he hopes more funding will become available to make the pilot permanent. Carlton says frontline workers deserve that support.
My ideal goal would be that these kinds of evidence-based tools and training and practices and policy shifts can be propagated across everybody who's choosing to serve like this, because we owe them at least that and so much more.
Laura Brown, CTV News, Fredericton.